Thanks for joining. My name is Carl Williams. I'm the state public health veterinarian in the communicable disease branch of the Division of Public Health. And again, appreciate you being here. So we're here to talk about the cluster of hantavirus cases that was initially reported by the World Health Organization associated with travel on a cruise ship. What we know about this is that there are uh, patients that have become infected with Andes virus, which is a particular type of hantavirus that is unique to Argentina. People have become sick, and 3 people have died. None of them have been Americans. The most recent update from the World Health Organization is from May 8th, and you can find detailed information about the outbreak there. And there were Americans on the ship that have been uh, repatriated back to Nebraska, which is where they remain, except for 2 that have gone on to Emory University. So there are about 17 Americans that are still in Nebraska and being assessed, and they may remain there or they may actually come home to their home states. And we are still in communication with our federal partners on that to determine exactly what's going to happen. But that is kind of the status of the situation at the moment. And I think we'd be happy to take any questions that you have, unless, uh, yeah, I think we just start there.
Yeah, thank you, Carl. So, whoever has questions, you're welcome to either put it in the chat or raise your hand, and we will go one at a time.
Hi, can you hear me?
Yes, go ahead, Lucy.
Hey, so right now I think we're just kind of wanting to know, is this kind of a concern that North Carolinians need to be focused on right now? I think that there's a lot of misconception as far as how dangerous it might be to the public right now.
Sure. I think a little bit of perspective and background on these viruses might help. Uh, these are not new viruses. So you may or may not remember the original outbreak of hantavirus pulmonary syndrome in 1993 in the Western United States in the Four Corners region. That was caused by a particular hantavirus called Cynombre virus. And it did cause a large number of cases, including fatalities. Um, so this is a disease that's likely been present in North America for some time, but most cases are from the Western United States. It's rare to see it in the Eastern United States. But what we know, because this became reportable in 1995, including in North Carolina, all the states have been doing surveillance for hantavirus since then. We've only had 1 case identified in North Carolina, and that was in 1995. That was with another hantavirus that we think was Monongahela virus. There have been cases in Florida associated with Black Creek Canal viruses. And what I'm getting at here is there are a lot of different types of hantaviruses, and not all of them occur in the United States, and most of them don't occur in North Carolina. In fact, again, in the Southeast, it's an extremely rare disease. These viruses also co-evolve with their rodent reservoir. So it's not like Andes virus is going to become established in the United States. This is something that is concerning if you live in Argentina or you travel there. Likewise, if you travel to or visit the Four Corners region or parts of California where this disease is endemic, yes, it could be a concern, but it's really not something we suggest that people should worry about here in North Carolina. It's something we've known about for a long time. In fact, the original outbreak of Andes virus was first characterized in Argentina in 1996. So these are not new viruses.
Thank you. We'll go to our next question, which I believe is Anna King.
Yes, so really quickly, we did see that there were some who were able to return home, but were not required to quarantine as much as I guess encouraged Why is that? And can we expect that to continue with, I think, the one person who was on the boat from North Carolina or on the cruise ship from North Carolina?
Yes, our understanding is that there were some people, including some people from the United States, that left the ship early, and they have returned to their home state. They did it in advance of the State Department coordinated repatriation. And you can find press release notices from California and Virginia about this. However, once the State Department became involved and the rest of the American citizens were identified, they were handled as a group. So they were all first taken to Offutt Air Force Base and then University of Nebraska Medical Center, which is where they all remain, again, except for two that were transported on to Emory. And I don't know, outside of the person who is from North Carolina, where the rest of them are from. Presumably, those plans are being made with their respective states.
Those
Thank
plans
you.
including quarantining or not quarantining.
So the CDC is not using the word quarantine, but they are keeping them for a risk assessment and clinical monitoring at Nebraska, and the people are free to stay there if they wish to.
We'll go to our next question in the chat from Patricia. She's asking if there's any additional details we can share about the North Carolina resident.
So no, at this point, we're not sharing any information about the person.
We'll go to our next question in the chat. Are we able to confirm if the North Carolina resident is positive or simply being monitored in Nebraska? And will that passenger continue to be monitored there or at home?
So they are being monitored in Nebraska. If they stay there, they will continue to be monitored. And if they come home, they would be monitored by their respective local health department. They have not been tested as far as I know, but I would say that testing for hantavirus is rapidly evolving. New diagnostics are being developed as we speak. So I don't think any of them have been tested, but don't take my word for that.
We also had an additional question in the chat about if this person returns home, how would that person be transported?
I'm happy
Kimberly,
to take that. Sure, I'm happy to take that, Carl. Um, Good afternoon. Thanks for joining. My name is Kimberly Clement. I'm the Assistant Chief of Preparedness and Strategic Operations for the Office of EMS. We are in close contact with a lot of different partners, local, state, federal, on what the transportation would look like. That has not been finalized at this point, but we would ensure that any plans that we put in place make sure that both the patient, well, all three actually, the patient, the healthcare workers, if they're involved, and the public are completely safe during that process. So until we know more information, we can't really finalize those details, but we are in process of plans and communication on that coordination when it occurs. When or if it occurs, I guess.
Thank you. Just to keep track of all these questions that we still got going on, we have a question from CBS 17. Are there any myths about the virus that you would like to address, given some misconceptions that tend to be out in the public?
I don't know of any myths offhand, but I think, we've seen, and I saw there was an interview with Dr. Wohl, and he was characterizing that this is not another COVID-like virus. This is a virus that is not easily transmitted. So this is not something that's going to become a pandemic. Yes, there are localized outbreaks of it, but they tend to be, they're nothing like COVID, so it's not going to spread like that. And again, they're closely associated with the rodent reservoir, and the rodent that is the reservoir for Andes virus we don't have in North Carolina. So even if the virus were to somehow make its way here, it wouldn't become established in animal populations here.
Thank you. One more from the chat before we go to you, Patrick. For those who have exotic pets or may keep mice or rats in their homes, is there anything that they should keep in mind?
Yeah, well, this is a bit of a fun fact. We are one of 4 states in North Carolina that doesn't regulate at a state level the possession or ownership of exotic or non-native animals. So people do have a lot of exotic pets in North Carolina. But again, these animals come with their own set of risks, but Andes virus is not going to be one of them. So I would only be concerned about, again, what they have typically been associated to harbor or transmit to humans. And when you're talking about exotic pets, things like mice and reptiles, you're talking about um, things like rat bite fever or salmonellosis. They are capable of carrying other zoonotic pathogens, but not Andes virus.
Thank you. Okay, Patrick, we'll go to you.
Thank you. Hey, Dr. Williams, thank you for taking the time to talk with us a little bit today. I'm curious, although that we now know that this is different than COVID-19, how does the coordinated effort, mass communication with local, state, and federal partners, as well as the importance of clear messaging, sort of bring up reminders from the past?
Well, I think in public health, we do this every day. A lot of times it doesn't grab the attention like Andes virus, but we have a system in place from the CDC down to the states and to the local health departments, all of the individual states and their local health departments to coordinate on responses to communicable or infectious diseases. And I'm sure that people may see this and be concerned about COVID again, but they should not be. I mean, this virus is distinctly different from COVID. It's again, it's not something that's novel like that virus was. This is something that's been known for quite some time, 30 years now, and it just doesn't transmit as easily as COVID, and it doesn't cause those large scale outbreaks like COVID. So I don't know if I answered your question, but we work collaboratively on trying to disseminate useful and truthful information as much as possible. And this is one of them.
If I can just quickly add, I think Carl's absolutely correct. This is something that our public health team deals with regularly, but we also have a lot of exercises and a lot of preparedness meetings and planning that happens all throughout the year. We actually did a full scale exercise on a similar type scenario last year that is very similar to this within the state. And so that is something that we are always preparing for, always ready to deal with. And that includes that coordination with our federal partners, our other state partner agencies, local agencies, and a lot of other entities that are part of those discussions. And the exercise last year, it included the airport, it included highway patrol, it included lots and lots of partners just in case we needed to bring them in. So I think it's important to say that this is a very different situation, but we are practiced for it, and it's something that we're ready and prepared for in North Carolina.
Thank you. We'll go back to the chat with a few more questions. We have a question from NC Newsline. As you've noted, there's no need for real concern for the general public about this turning into a COVID-19. But if you are someone who may be taking a cruise or traveling this summer, are there things you can do in general to stay healthy?
Sure. I think, the general recommendations you hear from public health all the time apply, and that's to make sure, number one, that you and your family and your children are up to date on all your recommended vaccinations. When you travel, the cruise ship industry has historically been associated with norovirus outbreaks, which is a gastrointestinal illness, although they've made a lot of strides in improving that and reducing the number of outbreaks. It brings to mind, hand washing and basic cleanliness. Always wash your hands, before you eat, after you use the restroom, things of that sort. I think when anytime you uh, have that many people together in that small of a space, you never know what can really happen. But I think that just basic precautions are what we'd recommend. And, cruises happen all the time. Lots of people are on cruises all the time without incident. And what we hear about are these rare circumstances. And I don't think that's representative of the whole industry. Having said that, again, I'd say get your vaccines, wash your hands, and of course at home, as we're heading into the summer months, we always recommend that you do things like if you have people over, cook your food thoroughly, and there's ways to prevent foodborne illness, basic public health messaging.
Thank you. Along those same lines, we've also received a question in the chat about how the virus spreads. They understand that it spreads through prolonged close contact, like the cruise ship situation. Are there any other areas where we might see similar concerns for spread? They included an example like tight quarters of a college dorm.
Yeah, I suppose if you're talking about Andes virus, those could be theoretical risks of exposure in Argentina and Chile. What we've seen in the United States with our native hantaviruses, especially Synombre virus, is that it's really when people are exposed to infected rodents and their feces, and these are wild rodents, these are not pets, but infected rodents and their feces, and they're aerosolized and people become infected. So I think that, anything's possible, never say never. But I think with this virus, that, spreading in a college dorm or things like that, certainly that's not something we're worried about in the United States.
Thank you. I saw in the chat, Elena from ABC 11 had a question. I don't see her on. If you're still on, you're welcome to ask your question. Okay, if not, we'll move along unless she comes back. Next question in the chat. We've seen responses from the CDC, but we've yet to hear a public address or conference from those health experts. How have the discussions been between us here at the state and our federal counterparts, and how does this differ from what we saw during COVID-19?
Well, the CDC has been scheduling regular meetings with states to inform them about this. So from my point of view, they're being communicative and sharing the information. Again, this is something that is, while the virus is not new, the situation is new, and they're working through this just like we are. So I'm sure they'll be communicating more in the future. I know they will with the states.
Another question from the chat. How has social media and/or the spread of misinformation made your job challenging, if at all?
Yeah, I'm not sure.
I think that's something, yeah, I think that's something that we deal with regularly in emergency response. We've seen that change a lot over the last several years. Misinformation and even more concerning disinformation has been a major thing that we have to address. I think one of the things that we continue to push and would love help pushing is to find your trusted leaders who have that information, your trusted sources. We include you all in some of those with the weather, things like that, telling people figure out who is that trusted source. Don't just read it online and take that for what is going to happen or what is the truth. I think local emergency management deals with that regularly, trying to put out briefings. So when we're not in the middle of an event like this, find who those trusted sources are and make sure that you're listening to them during these events, which really helps decrease that spread of misinformation and disinformation, and ultimately does make the response easier.
Our next question, what does this outbreak tell us about how closely human health is tied to environmental factors?
Yeah, that's a good question. I mean, I think the environment is always a source of, we can't live independent of it. But I think it's a reminder that animal health and human health and the proximity of humans and animals can have can have an impact on human health. I think we see this every day in North Carolina with other diseases like rabies, where we're surrounded by it all the time in our wildlife population, and in places like New Mexico. Again, they have hantavirus naturally occurring in their environment, and that's something they have to deal with, and then also in other parts of the world. So I think it just reminds us that we're linked, and we need to take care of the environment as much as we take care of each other.
Thank you. Our next question, what resources does the state currently have in place in case of a hantavirus outbreak, and how would those resources be deployed?
Well, again, we respond to all of the reportable diseases if there's an outbreak in one of them. And again, hantavirus pulmonary syndrome has been a reportable disease here since 1995. We have not had an outbreak of it, thankfully. In fact, none of the southeastern states have, to my knowledge, outside of sporadic cases. But our team in the communicable disease branch, we work closely with our university and medical partners. We work closely with all of the 86 local health departments. We work with Kimberly and her team in OEMS and emergency management. So we can bring together a pretty large team in a pretty short period of time to deal with whatever it is that comes up, because certainly we've had outbreaks in the state before that just haven't been hantavirus. So, yeah.